RSV infections are on the rise. A new national advisory offers help for high-risk groups. So here to explain is Dr. Daniel Kritzkis, Chief of Infectious Diseases at the Brigham. Dr. Kritzkis, thanks for being with us.
Happy to be with you. Good afternoon, Erica and Ben.
Well, Dr. Kritzkis, as you know, RSV is very contagious. It's a respiratory virus. It got a lot of attention last fall. Cases peaked early, and they were higher than what we had expected coming out of the pandemic. Are you seeing signs that might happen again?
Well, we're currently well below levels of what we saw last year. And at least here in Massachusetts, the levels are really pretty much at baseline, what we see in between epidemic episodes that come later in the winter. And nationally as well, the levels are really quite low. There might have been a tiny uptick in the last week or so, but nothing like what we saw last year.
Well, so the CDC has issued this national health advisory outlining some of the new medications, the vaccines. We've been talking about them. They're available to protect high-risk groups from severe symptoms. So what can you tell us about the options for older adults specifically?
Yeah, so for older people, prevention is really the name of the game. And there are two new vaccines that are both quite similar. They're protein vaccines based on the coat protein of the virus, and they provide excellent protection against severe disease. And people age 60 and older, and those with the same risk factors for severe COVID or for severe influenza would be recommended to get the vaccine.
Well, the other age group at highest risk, as you know, for RSV is babies, especially those younger than 8 months. So we don't have a vaccine. When can we find out more about protection for them?
Well, here we have a different approach, and that's to give a monoclonal antibody that would last it's given by a shot, and it would last in the baby's blood for several months to protect them throughout the RSV season. It's being recommended that infants under 8 months of age who are going into their first RSV season should receive this injection, and that certain infants who have particular health risks between 9 and 19 months might get this even in their second season. But for that, I really would suggest people should check with their pediatrician and see if your child is recommended to get this new treatment, which is called Nirsevimab.
Okay, Dr. Kritzkis, thanks as always for being with us.
Thank you.
You're very welcome.